One of the most frightening aspects of having a heart attack is that you don't know what's happening until the situation turns into an emergency. That's because heart attack symptoms vary widely from person to person. There are usually warning signs that happen hours or days before a heart attack but were ignored. Here are the most common symptoms of a heart attack that require immediate medical emergency help. Chest pain or tightness that spreads to your neck, arms, or back. Shortness of breath not caused by physical exertion. Nausea or heartburn. Cold sweats. Sudden dizziness or disorientation. Many of the symptoms of heart attack are the same in women and men. With men, chest pain is usually the first sign of trouble. Women are more likely to experience shortness of breath or pain in the back or jaw even before having chest pain. A woman may feel like she is getting the flu when actually the same symptoms signal a heart attack. Even dizziness or extreme fatigue can be warning signs of a heart attack in women. Not all of these symptoms indicate a heart attack, but it's time to seek medical help if you are suffering even a mild form of any of these discomforts. What exactly is a heart attack? When arteries become clogged from plaque and clotting, blood flow can become constricted or even blocked. Your heart muscle requires a constant flow of oxygen-rich blood, and if that gets interrupted for any reason, the heart muscle will be damaged and a heart attack will occur. Your coronary arteries can become blocked by the buildup of harmful cholesterol and plaque, a condition known as atherosclerosis. We invite you to view the Pahula video on atherosclerosis for a more complete explanation of how arteries can become blocked and what causes those blockages. Heart attack is different from cardiac arrest, which is when the heart stops pumping because of an electrical interruption in your heart. A heart attack is a blockage of blood flow to the heart. If you observe someone who is apparently suffering a heart attack, there are several actions that need to be taken immediately. Someone should call 911 for immediate medical help.
Call 911!
CPR has gotten less complicated, and even a person with no CPR training can perform a life-saving procedure. After checking that nothing is blocking breathing, you should start chest compressions in a hard, fast rhythm at the center of the chest. Put both hands together and use your body weight. 2 compressions per second is ideal. Continue this pattern until medical help arrives. If someone nearby is trained in CPR, they can take over. The risk factors for heart attack are well documented but are worth repeating. Smoking is a big factor in creating the conditions for a heart attack. The older you get, the chances for a heart attack increase. Men over 45 and women over 55 are at increased risk. Obesity, stress, diabetes, and unhealthy diet, all of these situations can increase your chances of developing blockage in arteries that could lead to heart attack. Again, we encourage you to watch the Pahula video on atherosclerosis for a complete look at risk factors in blood circulation. If you have a history of high blood pressure and high cholesterol, your doctor has probably started you on a program of prescription medicines and lifestyle changes to reduce your chances of having a heart attack. On your regular doctor visit, it's important that you tell your doctor if you are experiencing any symptoms that make you think you are at risk of a heart attack.
Like I said, it was more like somebody took a pencil and shoved it about halfway into my chest, you know?
Okay, now that...
You can make yourself a good patient by being honest with your doctor about any changes in your health. Chest pain, dizziness, unexplained nausea are not normal, and your physician needs to know. Your doctor may want to conduct further tests to determine if you are at risk for a heart attack. Blood tests can help diagnose any unusual enzymes indicating a damaged heart. An ECG, or electrocardiogram, where electrodes are attached to your chest, can determine if there is a heart rhythm problem, indicating an injured heart. A stress test can measure blood flow and detect blockage in arteries by monitoring heart activity during exercise. Imaging and scanning devices aimed at arteries can detect blockages and abnormal blood flow. If your doctor determines that you are at risk for a heart attack, even if the current symptoms aren't life-threatening, you will be prescribed certain blood-thinning medications, including aspirin and, if needed, blood pressure medicines, as well as cholesterol-reducing prescriptions. In some cases, your doctor may determine that an operation may be required. We invite you to watch the Puhula videos on bypass surgery for a complete look at what is involved with surgical solutions for heart problems. Medication is a good start in preventing a heart attack, but it will take a change in diet and lifestyle to ensure against heart problems. Puhula offers many videos on healthy living suggestions, and we invite you to take advantage of these. If you have already suffered a heart attack, the Puhula video on recovering from a heart attack will help you moving forward and getting your life back to normal. And also the important changes you can make to prevent this life-threatening event from happening again.